Good morning, everyone. It is nice to be back at my alma mater. A few familiar faces still left at the post. I am thrilled to be here for this very important conversation, and so grateful to our ACHP member, Kaiser Permanente, for its incredible leadership on this issue. For those of you that are not aware, last month, Kaiser Permanente announced a very exciting new initiative called Thrive Local. And today, Bernard has some brand new national survey data that sheds some light on social needs and communities and what the American public is really stressed about, as we were discussing earlier, Bernard, as well as you're able to tell us where you're going to launch Thrive Local this summer. So do you want to kind of touch on a couple of those high points to start?
Sure. Good morning, and it's great to see you and great to see everybody up this early. It really is early if you're coming from California.
For you. At least there was no Warriors game last night keeping you up.
But tomorrow. Really is great to be here. As you know, this is a critically important topic and strategic area for Kaiser Permanente, and we would argue for this country. And we are very pleased to be in the middle of helping to shape the narrative that many more would need to be actively involved in. And so this mega issue that we have going on requires all hands on deck. And so Kaiser Permanente is committed in each of our communities and around the country, but it also requires many more who are also figuring out how to get more involved and engaged in everything. So the survey for us is validating to us that we're on the right track, that as you think about health and healthcare in the 21st century, as we begin to shift from all of us relying on a healthcare system that's there when we get sick, to a healthcare system that is there to maximize the healthy life years of individuals. The ability now within the healthcare system to detect issues going on inside of your body earlier and earlier, as we've been able to prove inside of Kaiser Permanente, is the best form of medical care, because you go upstream, you deal with it early on, you manage it with the patients through our Permanente physicians, and then you end up in the teams and you end up with a better outcome. Well, this takes it now to the next level, because this says we acknowledge that medical care plays a very important part, but it's not the total solution. And so as we think about living healthy lives in the 21st century, there are other factors that affects that very directly, and we've been talking about that. Where you live, your zip code, and what the infrastructure is in your zip code affects your health. And so we've spent a lot of time over the years talking about those areas in the country in which it lacks the basic infrastructure, like grocery stores, like a secure environment for children to go out and play. Like school systems that are lacking the resources to both encourage and enlighten the students of the 21st century. And so now what we're doing is we're looking at the social needs in the communities that helps people to live healthy and fulfilling lives. One of the major things missing is a coordinated way for people to tap into those resources as needed. Mm-hmm. And everybody is there trying to fend for themselves. And so the survey that we did, I think we are both encouraged and amazed with the alignment of what the American people are feeling, consistent with the needs that we're trying to get addressed in the country. And so the people in the survey were clear that they see a direct connection between their housing situation, the lack of foods, the kinds of things that are stressing all of us in the 21st century, is affecting their health from their own personal perspective.
And the other thing that really came through in the survey data, if I remember correctly, more than a third saying they're just not certain where or how to find resources. And that's really the bridge that you're trying to create here. Is that right?
Yeah, I mean, when you look at the ongoing resources that have challenged if you will, the social need infrastructure throughout the years, you have a lot of great organizations, a lot of nonprofit organizations and other organizations who are doing great work, but in many cases they are one-off. And so there isn't an integrated approach where someone can tap into those resources with ease. We are an integrated system. That's our competency. We know how to integrate and to connect the dots. And we are a mega health system, right? And so we cover 13 million members, technically 12.4, but we'll round up to 13 million.
Sure.
And we exist in communities with 68 million people. And so our line of sight is 1368. And so we think that way all the time, and we can bring resources with the competency to integrate and connect, and then we put it on the backbone of technology. And so that's what we want to bridge.
And I'm so glad you brought up the word integrated, because as you were sort of saying in your opening, too much of the healthcare system in our country today is an acute care treatment system. Right. And I would argue it's because too much of medicine is still fee for service. You pay to have something done to you. So of course the Kaiser Permanente and all of our ACHP members have a model that's different. So maybe just share with this audience, in the case of Kaiser Permanente, when you have the health plan, you have the physicians, the nurses, the hospitals, and the community now all coordinated with the aligned incentives. What does that give you the ability to do that might be hard in fee-for-service?
Yes, when you look at the challenges of the healthcare system in the 21st century, on one side, I wake up every day excited about the new possibilities. Things that we see happening now that gives me great hope about the future of where health and healthcare is going. So, inside of the Kaiser Permanente system, we have patients who will be in our operating rooms this morning, many of them in the outpatient setting, but also inside of the hospital, getting a knee or hip replacement, and by this evening they're going home. I mean, unbelievable. We have patients who will be in today and they will have a heart procedure, maybe cleaning out the arteries or something inside of their heart, and within 24 hours they will be home with all of the home care and support traveling with them. We are now living in the 21st century where we are thinking through how now to prepare for more curative medications and other ways in which we now see a future where some of the diseases we can cure. And we saw that miracle, if you will, with hepatitis C. We now have systems like in Kaiser Permanente where you're connected 24/7.
Yes.
So I can reach my doctor at any given time, and I do. I love my doctor. And so you have all of this. The big question, though, is who's going to pay for it? And as a bigger society, are we willing to say in the 21st century that some should have this and others should not? And some of this is very expensive. We have a healthcare industry, we have a system that pretty much is fee for service, that the chassis is I do more, I get more. We demonstrate inside of Kaiser Permanente with our prepayment system, with total integration where all the key stakeholders are sitting at the same table. And so when we look at, as I call, the whole dollar for a patient, we have all of the key stakeholders together for us to decide together the best use of that dollar for our members and for our community. If you're only coming at this from the hospital system standpoint, you naturally are thinking about what portion of that dollar do I need to advocate for and to gather?
Oh, the old phrase is butts in beds.
Exactly right. And so you end up with a very fragmented system in which everybody is chasing, as I call it, the incentive around the same dollar. Inside of Kaiser Permanente, in the center piece for us are our members and the communities. So our conversation is about what's the best care possible and health-related services possible that we can give to our members and to our communities to maximize their health. That's a very different conversation than how we're going to deal with patient days and the revenue sources,
Right.
et cetera.
And so let's extend that, though, because even though Kaiser Permanente, again, like all of our ACHP members, mission-driven, not-for-profit, but no mission, no margin, as the cliche goes. This social needs initiative that you're now launching this summer and is a big undertaking, is there going to be an ROI? What is going to be the ROI?
Yeah, I mean, the answer is yes, and no mission, no margin. But we consider margin like air. You need air to breathe, right? The only time I worry about margin is when
There isn't any.
none, right? But the difference, though, is that the margin goes back into the mission. So that's, for me and for Kaiser Permanente, that's the perfect system. That we still look at the management of the total dollar. And so right now, less than 3 cents of the dollar goes to the bottom line. In fact, it's closer to 2 cents. And that's more than adequate for the strategies that we're deploying to go back up into the system. And so it's a holistic approach in how we do this. And so inside of that, inside of those economics, we are investing in our communities, which is part of the benefit and expectation of a large 501c3. And we are getting the returns both by meeting the social needs of the communities, as well as the funds working back with more efficiencies being provided to the overall system that we get to put back into better rates for our members so they don't have to pay as much.
Correct me if I'm wrong, though, but isn't this network, this social network that you're deploying, aren't you going to make that available to lots of different organizations that are not Kaiser Permanente?
Yes, and that's what I mean by our 1368 line of sight, that we are investing in and building capacity that can go far beyond the 13 million members that we're honored to take care of. It can also reach into the communities and help many others in the communities. And so we have an all-in strategy to work with other health systems and other civic organizations and the likes to end up with a holistic approach that many millions more can get their needs met.
So housing, food insecurity, transportation, bring this to life for me. In one of your regions, you're based in Oakland. Paint a little picture of how the heck that affects my health.
Well, think about the basics of life, food, right? The survey says what we know, but validates that many people go to bed hungry every night. Many people make choices about how many meals they can eat in a given day and which ones in their value system is the most important to do. Many of our medications requires eating on a stomach with food in there.
Right.
So think about someone taking medications that's completely opposite of the recommended approach to dealing with that. The survey shows us that people are making life choices in their homes every single day. Do I buy the milk or do I get the medication? When we have the lack of a transportation system in communities, then people can't get around as much as what some of us take for granted on a daily basis. I think the worst of all of this is individuals who only address is the streets of America, and those are the homeless. Many families are right at the edge of homelessness. I think the bigger societal question for all of us is, what do we accept as a basic American life? And I would argue a shelter over your head is one of those things. So these aren't simple issues that we're addressing in the 21st century. These are real issues. I think the other thing that is clear is now that we're all wired 24/7, now that social media is affecting all of our lives day in and day out, and we certainly are focused on young people because we see the direct relationship of social media with depression and all forms of social challenges. How do we begin to think about a holistic approach of how we address all of this, all intended to help people simply cope with and live and aspire to have the best life possible?
Yes. Well, incredibly, we're out of time, but please join me in thanking Bernard Tyson of Kaiser Permanente.
Thank you.